have them do weighted balls for kicks, right? So what? For both fun and exercise. So anyways, I'm gonna have Jennifer come up here and be my assistant on this one.
Okay.
So I'm gonna have you can just do a straightforward kick. So you can be here with them, you're strengthening that hip, you have them working on, and you can go multiple directions, or you can work on just trying to straight flex, okay? If you want it to work, so turn sideways for me, and I'm gonna roll it in, and I'm gonna have her work on abduction, right? You don't want to obviously do a super heavy weight because, yeah, I wouldn't do more than the 2, maybe 4 pound. This is the 4 pound, and just kind of work on, and it can work with any direction, and it's a good way to kind of do something that's a little more active and a little more fun for them.
You said you can't do that until a 4. Could you do it with a 3+?
You can do a 3+, yeah.
As long as they have the balance to
Yeah,
stand.
and that's the thing you just have to really watch is you got to make sure whoever it is has pretty good balance, or you're co-treating with an OTA, which we do some too. So anyways, that's just one option. There's about a billion. Once you hit 3+, that's when it gets fun, because then you can start doing, more exciting and interesting things and play games and stuff like that. But ball kicks I used a lot actually, for the hip, and then you just throw in this too. All right. Okay. So moving on down the body, although there are a couple that we'll still get. Even in supine, you can do ball stuff. You can do ball squeezes, which I showed you the other day. But for really kind of works those internal rotators and adductors, ball squeezes, right? The other one that's isometric is glute sets. Glute sets are just literally squeeze your butt cheeks together, squeeze and hold, and have them hold. The weird thing about those is like, there's no way to really kind of tell. And I swear, like half the time I had people do them, I swear they were like, yeah, doing them. And I'm not.
If they're doing them right, they should raise up just
You
a little.
should see it, but I'm also not gonna go. I'm not gonna put my hands there. I don't feel it. So, a lot of times I'm like, no, you're not, and they're like, yeah, I really am. Whatever. Like,
You're lost.
so anyways, glute sets, you just have them lay on their back and squeeze, okay? All right, so moving down the body, I'm going to steal your plinth here for a little bit. You can do isometric for the knees, okay? So there's quad sets, okay? Quad sets are just, I'm pretending like I'm pushing my knee down through, okay? And I'm just tightening these quad muscles isometrically and holding them. You can also put a towel or a ball underneath and have them push. I've found that the tactile cueing of a towel or a ball actually helps. This is another one where if they don't have something to actively push into, I don't see the same kind of contraction personally.
Yeah. This is at what grade?
This is really be a 1. So these are just isometric ways to isometrically contract.
This is something you can work on like after knee surgeries.
Yeah, and specifically like total knee replacements or any knee surgery, quad sets are huge to start with. That's where everybody starts.
Can you do that when they don't have full extension yet too? If you put something under, just a way to.
Yeah, and if they're not even allowed full extension, then you get a ball or a bolster or a foam roll. And if they're not allowed full extension yet, which you'll still see sometimes, just have them do it onto that. So they're still firing those quads, but they're not getting the extension that they're not allowed to have or don't have yet, one or the other.
And is that technically closed chain?
This?
Yes.
No, not technically, but isometrics isn't really ultimately about open or closed chain. Okay, that's open and closed chain really doesn't kick in until you have movement, and so I'll talk about that literally here in just a second. So the other, where's the ball? The other one for the knee, obviously, is we did extension, the extensor muscles. You can do the same thing though. So have them dig their heel in like they're trying to bend their knee. Okay. Once again, it works a lot better if they have a towel that they can push into, but they should feel it, obviously. And if you try it, put a towel or a ball underneath and try and bend your knee, you can feel it firing those hamstrings back. Okay? So those are the isometrics for those. Okay? All right. Moving on. Once they're a little bit past that, the easiest progression really after that is heel slides. Okay? Back and forth. Okay? If they're at a 2, you can put them in sideline and let them do these. You just have to hold up the top leg. Okay? If they're at a 3 and they're trying to get it moving, then just heel slides, because you're getting both knee flexion and extension and hip flexion and extension in here as well. So heel slides are like awesome because they do just a little bit of everything. Then as they get better with that, you can add a weight, obviously, an ankle weight to that. Or you can even do TheraBand, have them pull in one direction, whichever direction they're weakest in, pull against it. So just wrap it around. So I need somebody to help this one. Anybody else? Okay. Oh, Eric. Sorry.
You also do it like up on the wall, like this, where they're sliding down like that?
Sure.
Or is that like gravity assisted?
It would be gravity assisted for what? For the flexion, but not the extension. It would actually be against gravity for the extension.
For some of my total knees, I've actually done that and put them on a Swiss ball. When knee flexion was super painful coming out of surgery, I did it that way so that they would get a little bit of help from
Some
gravity.
of those Swiss balls on the wall you
Yep. And you go up and down the wall, and then gravity helps pull them a little bit more into flexion, so you're getting a little bit of a stretch on it too, right?
And that's if they don't have full flexion?
Well,
Or
I've,
both?
I've
If the-
done it in that position. Like, if heel slides are just killing them, and sometimes it is, knee surgery is very, very painful, then I'll just put them up against a ball on the wall, or I'll have them sit on a Swiss ball and roll into flexion and use their body to do a little more.
Okay.
And it's a little less painful than the others. So great for some of your total knees that come out and they're just in a ton of pain.
And they will be.
Yeah.
They will be. And this total knees are tough because it just hurts. And the stretching and stuff, this is one of those times where you feel guilty. Because, no, seriously, and there's no way to avoid it. There's no way to avoid stretching a total knee where it doesn't hurt. I've had people crying, and they're like, I know I need it, you know?
So how do you know if you're hurting them or they're just in pain?
Well, and that's the thing is you just have to talk to them and explain and communicate with them what's going on and say, you know the difference between, yeah, that feels like a really tight and even somewhat painful stretch versus, no, it feels like there's something going wrong. Okay? And if you feel like there's something going wrong, you got to let me know and stop. But the thing is also you just have to trust. If it's after that 2 weeks, that knee's set. It's not going anywhere. There's nothing you can do to mess it up. Okay? Really. Unless they're just really pretty old, like 70s or older, man, you can put just about as much pressure as you need to on that leg. And even at 70s, you should be able to put a pretty decent amount of pressure on that leg. It's set, it's there. The chances of you actually being able to break some of these bigger bones is almost none.
So they're just dealing with surgery pain.
Yeah. Well, and it's because that joint gets just so tight and it's so swollen afterwards, and The scar starts to kind of adhere, and you just gotta get it moving. And it's, oh man.
Did they show any total knee surgeries in patho or anything? Did y'all see them?
No, we showed. Yeah, I showed one.
It literally pounded something into your back.
Yes.
Yep.
So if you think about how much surface area they've replaced, and it's just bone here. Your hamstrings and quads are up here, right? There's no muscle, there's no blood flow, there's just a lot of nerve endings and bone. So it hurts. It hurts really bad. Total hips don't hurt as much. We got good blood flow, we got all kinds of good things that make it's painful, but nothing like a knee. Think about how much surface area has been replaced. And yeah, if you've seen it, they literally take sterile Craftsman tools basically and pound in those replacements.
Yeah, it's insanity. Like,
So they'll be bruised from here to their ankle sometimes, depending on how many times they had to fit a piece. So when I went and watched one when I was a student, they had to pull out the pieces 3 times because she had like an awkward shaped knee. And so when she came out, she was bruised from here to her foot because of how many times they had popped it off and pounded a new one in before they found the right size for her.
right? If it takes extra time, what's going on there is they're actually bleeding internally, and there's no way to, like, they suction, you know, in there, and they try and get stuff out of the way, but the stuff that's going down, it'll pool, and so it'll make this like just massive bruise. You know, I've seen people with both hip and knee that literally their entire side of their leg, either the side depending on where they're laying, the inside or the back of their leg is just one big purple kind of nightmare. And so you know that adds an extra week or two of extra pain to it. So anyways, heel slides. You can put this on here. Make sure you're kind of keeping it flat so it's not bunching it up, because they don't like that. It's sticking. Okay. Somewhat bunched up. And then just have them, so bend your knee, and I want you to slide your heel back. So you can go back. Obviously on the way out, okay, you can have them kind of eccentrically resist and then just go back. Or you can just switch position, and if you want them to focus more on knee extension, go back and then hold it here, and then they resist as it goes out, but it pulls. See, that's why I don't love TheraBand actually. Okay, but just know that you can do that. The easiest thing to do though is just get an ankle weight, add it to it. Okay.
Is a yellow TheraBand? I mean, this is the strongest groups of muscles in the body. Is a yellow TheraBand the
Still,
choice
well,
for that, or?
the thing is it doesn't, like, if they're a 2+, right, and you're starting to get into some resistance, doesn't really change that these are large groups of muscles. If they're at a 2+, they're still at a 2+. Does that make sense? And you still treat them exactly the same way. They may recuperate quicker, they may get stronger quicker, which you'll see, but you're still going to treat them at the same way, because a 2+ is a 2+ is a 2+, no matter where it is on your body. Does it make sense? Yeah. So, like I said, you can do it with TheraBand. You can add an ankle weight to those. I'm going to just continue to steal you. So, other ones you can do, starting out, if they're struggling with the last little bit of extension, besides stretching, just here, and you can put the other one over too. These are called short arc quads, okay? Strengthening the quad, but it's just that last little bit. The nice thing with these is if you know somebody has VMO weakness, that lateral tracking of the patella that we talked about, where we want to strengthen the VMO and stretch the IT band, right? Because IT band's too tight, pulling it over here, and VMO is too weak, and it's not holding the patella in the right place. These are really good because they focus that last 30 degrees is basically, it's kind of interesting. So they fire literally laterally and then across the muscles. And so like if you're back here, you're really firing vastus lateralis. And then as you get kind of to here, you're starting to fire rectus femoris more. and vastus intermedius, and then as you get up to that last little bit, you're really firing VMO to finish it off. And so this is one of the ways, and there are others, that we can focus on VMO, okay, by doing short arc quads. You're still getting vastus lateralis, vastus intermedius and rectus femoris. I'm here with this too.
So
The-
you could only do this with them if they were a 3, because it's against gravity?
Right. They have to be a 3 to do this, and there's no. If you want to do short arc quads, you could just have them in sideline for gravity eliminated, and just have them start at a limited range of motion and bring them back. Does that make sense? So here, let's show.
It's another one where you do a lot of rhythmic initiation to get that quad thinking about firing, being in that gravity position, and taking them through active assistive
So I know
to try to get that
so
brain to
each
think
layer
about
side.
firing that quad.
So she took off her shoe, and then I'm gonna make her do this. But we're holding this, okay? And if they're at like a 2 minus or a 2 plus or whatever, gravity eliminated, or a 2, and I just want you to bring it out now. So finish it off, and okay, so just bring it back just to about there for me, okay? And then just do that again.
Could you just block them right there so they can't go any farther?
You can. There are ways you can put something there like a ball. I've done that before where I just stuck a ball between there and my thigh and said, I just want you to finish that last little bit. Okay. You can.
Which, everybody that comes in is not automatically gonna be rated at a 1, like you could have somebody come in and already be a 3 or a 2.
Honestly, most times, the vast majority of times, people are 3 or above. I rarely did I see. Every once in a while, I would see a 2 or a 2 plus. Okay, but I don't know. I don't think I worked with a 1 except maybe once or twice in my entire career. 1s are just really rare because what's going on there is something has happened. Either they've just gotten that weak and been like in a coma or something for a long time, or something neurological happened, and for some reason they've still got fire. The 2 times I've seen it, I had a CVA patient who could still fire a muscle but could not get it to move, and that's where rhythmic initiation really does kick in more. Rhythmic initiation mostly works really good with CVA patients and neurological type issues, brain aneurysms, TBIs, or spinal cord injuries of some extent too. And that's the other person that I saw it with was a partial spinal cord where they didn't have a complete cut of the spinal cord, and you guys will learn about those in Christina's class. But so there's injuries to the spinal cord where not the whole spinal cord gets cut, but part of the spinal cord gets cut, and so they're just not getting all the signals they're supposed to get. And so then you will get like weird parts where they're able to fire like flexors, but not extensors, or vice versa, and it's weird. It's a strange thing to see, and I've seen some where it like only partially cut some nerve fibers, and they could, like they had a 1, but they just could not get beyond a 1. But you just don't see it a lot. Mostly, and I don't know, maybe you've experienced different, but mostly I saw 2 plus, 3 minus is where people came to me at, and I was trying to get them to where they were functional again.
Because typically they come out of surgery with some kind of movement. Even if you're locked out in an extension brace, which I was with my ACL, I still had times during the day when I would get out of that and still do some range of motion stuff, just not in a closed chain position.
And so even as they get weak, they might have been a 5, then they have their ACL surgery. You keep them isolated. By the time they're done with it, they might be like a 3 or a 2 plus, but I rarely ever saw like 2s and even when I worked with the elderly, you just don't see it very much. It's rare, but you do need to know how to do it because sometimes you do see it.
Yeah, I just was like getting in the like I think sometimes we get in the mindset that when
We're always going to walk through that
it's
whole
like
progression.
always going to be from 1 to 5,
No.
but it's not always
Although the flip side of that is when you first start working, and this is why I tried to go. There's two things you have to consider because it's not just muscle grade. It's also where they're at in the rehabilitation process, right? The phase that they're in. If you're in the acute phase, you might not technically be a 1 strength-wise, but I can't do much with you but passive range of motion and isometrics, right? And muscle settings. So then I may be still looking at like alternating isometrics to help treat that. And so it isn't always only about muscle grade, it's muscle grade and where they're at in that recuperation healing process. Are they a phase 1 acute phase, phase 2 subacute, or phase 3 where we're moving into strengthening and moving into more functional activities, phase 3, phase 4. Does that make sense?
Yeah.
Okay. All right, so short arc quads are super cool and very good for strengthening that VMO. I'll have you turn to this side, okay? Then you just have, let's kick our leg up and bring it back down slowly. These are long arc quad, right? Okay, once again, you can do these with an ankle weight or a TheraBand. Problem once again is TheraBand, once it gets to about here, even if you keep it flat, it's going to start to roll and bunch on them, and then it's going to slide up and down their leg. I don't know. TheraBand is good sometimes, but it's also super frustrating at other times. So I always kind of went with ankle weights in those situations. Obviously, what would you have to be to do these? A 3, at least a 3. But you can do them in gravity eliminated as well, just like I showed you, except you're having them go the full range of motion. Good. Then you can add, like I said, ankle weights and things to those. Now, the thing with the legs is once you get beyond that, oh, I meant to grab. I'll be right back. Oh, there's one other thing. Okay. So, long arc quads, I forgot to mention one thing, okay? If I keep it straight, it's going to hit more vastus, medialis, internus. What is it? Intermedius. I said it like 3 times earlier, and then my brain just was like, vastus intermedius and rectus femoris. If I keep the foot straight. If I turn the foot in and do it, okay, then I'm focusing more on VMO, okay? And if I turn it out, then I'm focusing, and you can literally feel it, I'm focusing more on vastus lateralis. Okay, so straight, you're going to feel it more in the middle. Turn your foot in, you're going to feel it more at the VMO. Turn your foot out, and you're going to feel it more at vastus lateralis.
So, nothing that you've done on the knee is something you can't do at home.
Right.
So is that just happens to be with the knee? That's just how it is?
No.
What's your question?
Everything that we've seen, a patient can do at home.
Right.
So-
I'm just running through everything, just like I did with the hip. I started with, isometrics, and then I went through just the regular ones, and then we kind of finished with PNF ones. So
Okay.
getting there, but you can do like slow reversals. Okay, push one way, push the other way, push one way, push the other way. Alternating isometrics. You can have them fire one way, fire the other way. The only thing with alternating isometrics with the knee is you are limited in the fact that you only have extension and flexion. That's it. Like there's just no other options. And so the nice thing about the knee is like It doesn't get massively complex like the hip and the shoulder, where you're like, okay, wait, what am I doing? It's flexion and extension. But yeah, we'll get to more of those, and I'll show you, and we'll demo.
For a grade 1, can you do isometrics sitting? I mean, not because they're only getting a trace flex out of it or whatever. Can
Right,
you do
so
them in a
that's-
sitting position? Or?
That's where quad sets, pushing down, putting a towel under their knee, or putting a towel under their ankle and doing hamstring sets really comes in. And that's how you fire them isometrically. You can technically, like you could, you can't do it supine really, right? Because it's just weird. So you could technically put them in like side lying, I guess, and do it, but it's just a lot easier to just do your quad sets and your hamstring sets. Does that answer?
Yeah.
So anyways, with those long arc quads, you can emphasize middle, lateral, or medium. Okay? All right. Thank you. So, once they're pretty advanced, some of the very best exercises for strengthening are just step ups and step down. Okay? Up and down. Up and down. If they're really far advanced, just have them try and go part way, which I don't know that I'm actually strong enough to do that. But plus I could carry just a pound or two extra over. So, anyways, you can have them do forward. Okay. So you're strengthening what here? Quads mostly, but if you have them control it as they go down, then you're getting that eccentric firing of that too. You're actually getting glutes in there too, because as they finish that out, they're having to straighten up and kick that in. So step ups and step downs are something you can really move to. And then you can do weighted ball for kicking. I'll have them sit and kick a weighted ball back and forth to me as well. And then these guys, okay? So what those look like, let me get another volunteer to come sit here with me. Thank you. That just means I get to take your chair too. So maybe gather around, since she's on this side. And so, okay, so slow reversals or alternating isometrics, we'll start with that. Alternating isometrics, push, push, push. I should have known.
Sorry.
Always
I'm telling
you.
you, man.
Okay, so I'm gonna really resist, right?
We're
Push.
doing full relax.
Push.
I was like,
You have some of the strongest quads. She's definitely a 5. Okay. So anyways, you resist in both directions. You can have her pull back. So pull, pull, pull. Not so strong with the hamstring. Pull, pull, pull,
So
pull.
with the long and short arc quads, can you have them like prone and put the weight on them and have them do
Yeah.
the hamstrings?
Yeah, you can put them in prone and do hamstrings, which is against gravity as well. And I actually have done that if I was really trying to focus on the hamstrings. So good point. You can have them in prone, put an ankle weight on them, and have them do hamstring curls, which I didn't show, which, once again, thank you. And that's a really good way to just isolate the hamstrings. One thing also, and I'll tell you in just a second, remind me, I want to talk about how you isolate butt versus hamstrings as you're doing different exercises. So anyways, you can alternate isometrics, okay, go both directions. You can also do, so I want you to push up. This one I'll be able to do, although not slow. And then back down. What am I doing now? Slow reversals. And then I could have her, okay, so I want you to push up slowly and resist me. Good. And now I want you to continue to resist me, but go slowly back down. And what is that? Agonist reversals, okay? So you can do those things as well. Obviously, PNF patterns come in if they're fairly good in their hip and fairly good in their knee, or wrap an ankle weight around them and have them do the different PNF patterns as well. Okay? Getting back to what you hit on, it's important. Would you lay prone for me? So because we have this action, which is hamstring curl just of the knee, but the hamstrings also fire for what? Extension too, right? At least some of them. All right, so how do I make sure, if I want to emphasize hamstrings, how do I make sure I do that? Or if I want to emphasize butt, how do I make sure I do that? Anybody know?
For knee, stabilizing the hip, keep the knee on the table and make sure they're bending back and forth.
It does have to do with the knee. So if she keeps the knee straight and lifts into extension, she's actually focusing more on hamstring. Okay? If you bend the knee, hamstrings are now shortened, and then we lift here, it makes sure that we're focusing more on gluteus maximus, the big booty muscle. Alright? Okay?
Right.
Good? Alright. Does that make sense? Good. So, any questions on those? Alright. Pair up somebody completely different again, and we'll rock and roll. Run through those.